Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and we're going to be covering pediatric, endo, and cardiac disorders. It's a short Kahoot, I think about 12 slides. But before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a private tutoring session. You can sign up for an NCLEX review, both part 1 and part 2. You can sign up for consultation session. Maybe you just need to pick my brain about something. You can also get audio lessons. If you're a current nursing student and you're struggling, you just really need that push, be sure to check out the audio lessons that I have available again on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook. My handle is the same everywhere, Nexus Nursing. All right, guys, without any further ado, let's get started. Endocrine and diabetes. Remember, guys, this is PEDS. First question. All right. This heart disease causes systemic vasculitis, usually occurring during the toddler stage, and it's self-limited. What disease are we talking about? Are we talking about Kawasaki? Are we talking about congestive heart failure? Are we talking about infective endocarditis? Are we talking about anaphylaxis? So it's a disease that causes systemic vasculitis. It usually occurs around the toddler ages, around 1, 2, 3 years old, and it's self-limited. What do you guys think? All right, most of you guys got the answer correct. It is Kawasaki disease. So here's a couple things you have to know about Kawasaki disease for testing purposes. You need to know that the etiology, the cause is unknown. We don't know what causes it, but we see it more in, like I said, the toddlers, right? And when it comes to race or ethnicity, we tend to see this more in Asian children, okay? And like the question says, systemic vasculitis. So all those vessels, I'm talking about the arteries, the arterioles, all of them are what? Inflamed. That's what we're dealing with. It's usually self-limiting, and the treatment that you would expect for this disorder is going to be high-dose IVIG. You expect to give salicylates. And here's something else that's very interesting. Aspirin. We never give aspirin in peds, right? We are always worried about Ray's syndrome. We never give aspirin and peds. And so whenever I teach about aspirin peds, I always teach we never give aspirin except for very few disorders, and Kawasaki is one of them. The patient with Kawasaki disease, you expect for them to get aspirin. That's part of the treatment plan. Signs and symptoms you have to be aware of. You have to be aware of that strawberry tongue. You got to be aware of that redness and peeling of, like, on the hands. You got to be aware of that cervical swelling. So make sure that you guys know Kawasaki disease if you're currently taking pediatrics, because you'll have a couple questions on it. All right. The code to get in, if you just came in, the code to get in is 338-502, 338-502. All right, next question. So which is a clinical manifestation of patent ductus arteriosus? Is it a murmur that's heard in the left sternal border? Is it a widened pulse pressure and bounding pulse? Is it blue spells or TET spells, or cyanosis and clubbing of the fingers? So we're talking about patent ductus arteriosus. Okay, so wow. More of you guys chose the wrong answer, but the correct answer, guys, is widened pulse pressure and bounding pulse. So you guys need to know about the difference of the disorders, those cardiac disorders, which one's cyanotic, which one's acyanotic, what's happening. So specifically, when we're talking about patent ductus arteriosus, what's happening is that there's supposed to be that closure within the first few weeks of life, but it doesn't happen, and it causes a shunt from left to right. Okay. And one of the hallmark symptoms that we'll see in this disorder is widened pulse pressure and bounding pulse. Now, these other choices you also need to know because it may be a test question as well. So let's talk about it. The first one, murmur heard in the left sternal border, that's ventricular septal defect. You have to know that disorder. Next one, blue spells or tet spells, that's tetralogy of Fallot or tetralogy of Fallot, however you pronounce it, but tetralogy of Fallot, that is the blue tet spells. And last one, cyanosis, that patient turning blue. You see clubbing of the fingers. When you see clubbing of the fingers, that lets you know that patient's been dealing with chronic hypoxemia. So when you see that, you should be thinking of tricuspid atresia. Okay. But again, when it comes to widened pulse pressure and bounding pulse, we're talking about patent ductus arteriosus. Don't say that I didn't warn you that you all these 4 disorders that I just talked about, you're going to have to know them for peds. All right, you're teaching a school age child about diabetes. Which teaching is correct? Is it morning glucose should be between 90 and 130? Is it eat a snack before basketball practice? Is it to avoid the use of regular insulin during illness or times of stress? Or are you going to teach them unopened bottles of insulin should be stored in the freezer until ready to use? Okay. And so, guys, the correct answer is eat a snack before basketball practice. Why? Any form of exercise can decrease the patient's glucose. What kills you faster, hypoglycemia or hyperglycemia? Hypoglycemia every single day of the week, right? So we don't want that patient to have a hypoglycemic episode. So you're going to teach them before exercise, make sure that they have a snack because we don't want that patient to bottom out. Some other important things that you guys need to know is that during times of illness or stress, because illness is a stress to the body, but during times of illness or stress, you expect that patient's blood sugar to increase. So the patient may need more insulin than normal. So you're going to have to teach about insulin during those times. And guys, of course, you know, the insulin unopened bottles, you're not going to freeze it. It can be refrigerated, but not frozen. All right, your patient just had cardiac surgery. You should notify the healthcare provider if the chest tube drainage is more than how many milligrams per kilogram per hour. Your patient just had heart surgery. They've got a chest tube. You have to notify the healthcare provider if you notice the drainage in that chest tube is more than how many milliliters per kilograms per hour. Remember, we're talking about peds, so everything is based on weight. What's the correct answer? Very good, Kiana. All right, most of you guys got the correct answer. The correct answer is 3. If you notice more than 3 milliliters per kilogram per hour, you're going to notify the healthcare provider. And the reason, guys, what may be developing is cardiac tamponade. This is a medical emergency, so the healthcare provider is going to have to be notified immediately. Very good. All right, which symptom of hypoxemia should be reported to the healthcare provider immediately? Would it be excessive crying? Would it be weight gain? Would it be weight loss or dehydration? Which symptom of hypoxemia should be reported to the healthcare provider immediately? Very good. Very good. Before I even tell you guys why, like the rationale behind that, let's just talk about dehydration. Let me tell you guys something, especially those who are brand new in the nursing program. You're trying to learn how to think, prioritize. I'm telling you now, anything that affects a patient's hydration status, fluid and electrolytes, airway breathing circulation, glucose, heart or brain, such as an MI or a stroke, that's going to be a priority. And sometimes the question is not going to be direct. It's not going to say, oh, like, you see how I made this direct and I put dehydration. The reason I did that, obviously, guys, because in Kahoot, I don't have enough characters to make the question the way you'd see it on a nursing exam. I have to get more to the point. But on a nursing exam, they'll describe dehydration. They'll say that you have a patient that's a runner. It's 12 o'clock in the afternoon in Florida or California to let you know they're running. It's hot, right? They've got dry mucous membranes. They've got flat jugular veins. H&H is increased. Urine output is decreased. You will get signs and symptoms of dehydration. You need to understand that dehydration is a priority. Why? Because dehydration can cause those organs to shut down. All right. So let's get back to this. Let's talk about the rationale. If a patient's hypoxemic, why would we report dehydration immediately, besides what I just explained to you? Well, I want you to think about it. With dehydration, what does that cause to happen to the patient's hemodynamic status? That blood gets thick. What happens when the blood gets thick? It puts the patient at risk for what? Stroke, which is another priority. Remember, I told you brain, stroke? Yeah. It all links together. So anytime a patient is dehydrated, you absolutely have to report that. Again, the patient's going to be at risk for stroke. You want to make sure the patient stays hydrated. You want to give them oxygen. And for this pediatric patient, this newborn that's hypoxemic, that may be dehydrated, also you expect that patient to get prostaglandin E. Okay? Make sure you guys know this. Don't say I didn't warn you. How are you guys doing on the live? Okay, good. Next question. Your patient exhibits dyspnea, tachycardia, wheezing, orthopnea, and crackles. What type of heart disorder is suspected? Left-sided, right-sided, sympathetic, or non-sympathetic? Look at these signs and symptoms. Difficulty breathing, increased heart rate, wheezing, orthopnea, crackles. What are we thinking? Very good. That's right. Left-sided heart failure. Patient will exhibit lung symptoms such as dyspnea, orthopnea, crackles, wheezing. Very good. Absolutely. Right-sided heart failure, we would see more systemic symptoms such as that weight gain, such as edema, such as the distended jugular veins, such as hepatomegaly, splenomegaly, right? Those systemic symptoms we would see more of, not the lung symptoms. You're suctioning a patient after cardiac surgery, and note tachypnea and dyspnea. Which action would you take immediately? Are you going to continue but closely monitor for signs or symptoms of distress? Are you going to discontinue the suctioning and notify the healthcare provider? Are you going to continue as this is an expected finding during suctioning of the patient? Or are you going to discontinue suctioning, assess the patient, and call the healthcare provider? What are you going to do? Very good. Discontinue the suction, assess them, and then call the healthcare provider. Whenever something is harming your patient, the first thing you're going to do is stop whatever's harming your patient. That is the first thing you're going to do. After you stop what's harming or injuring your patient, you're going to assess them. You're going to get information. Why? Because when you call the healthcare provider, you have to have something to say to the healthcare provider. You have to tell them what your patient looked like. You have to tell them what your nursing intervention was. You have to tell them what your patient looked like after the nursing intervention, then find out what further steps the healthcare provider would like to see happen. Very good. All right, signs, symptoms of renal failure includes a urinary output of blank and elevated levels of BUN and serum creatinine. Is it less than 30 milliliters per kilogram per hour? Excuse me, more than 30 milliliters per kilogram per hour, less than 30 milliliters per kilogram per hour, more than 1 milliliter per kilogram per hour, or less than 1 milliliter per kilogram per hour. If you are in peds, you better know this. Commit it to memory. Okay, the correct answer on only 3 people chose this. Less than 1 ml per kilogram per hour. 18 of you guys went with less than 30. And I know what you're thinking, because for the adult should release at least 30 mLs per hour. But remember, we're not talking about adults. We're talking about who? Pediatric patients. And for adults, we're not doing per kilogram, just 30 mLs. We want to see at least a urine output of at least 30 mLs per hour. But we're dealing with pediatric patients. When it comes to the pediatric patients, we're going to report anything that's less than 1 milliliter per what? Kilogram. All right, which type of insulin peaks 30 to 90 minutes after administration and lasts for about 5 hours? Would it be rapid, short, intermediate, or long? Which insulin peaks 30 to 90 minutes after administration and lasts for about 5 hours? Okay, very good. Rapid. I'm seeing on the live, a lot of you guys are typing in long. Let's talk about long. Long does not peak. All right. When we're talking about insulin peaks, when the insulin's peak time, no, that's not proper English. And insulin's peak time is when the patient's blood glucose will be the lowest. So when it comes to long acting insulin, long acting something like Lantus, think of Lantus for long acting, right? Something like Lantus, you get a steady amount of that insulin throughout the day. There is no peak. It stays steady throughout the day, okay? So long acting is steady. There is no peak. Now, with that being said, something else that you guys have to be aware of is, like I said, because you guys get test questions wrong because you're not thinking about it the correct way. If you see a test question asking you, it tells you that the patient is taking an insulin and it's now the peak time. What are you going to be concerned about? The concern is going to be the patient's blood sugar being lowest. And remember, hypoglycemia will kill you much faster than hyperglycemia. So the peak time of insulin, the time that that insulin is working the hardest, it's the highest, is going to be the lowest time for the patient. The blood sugar will be the lowest. This is where you're going to be concerned about them passing out. This is where you're going to be concerned about them having a hypoglycemic reaction. This is where you're going to monitor them much, much, much more closely. When you get a test question asking you about insulin and they're asking you when would you expect to feed the patient, they're asking you about the onset, because the onset of the insulin is when the insulin starts to work, and we want to make sure a patient doesn't have a hypoglycemic reaction. So we would make sure that the patient would have their breakfast tray there by that onset, so that they don't have a hypoglycemic reaction. When you get a question asking you when would you assess the patient more closely, or where would be the most um, time of concern, what they're really asking you is the peak time of the insulin. When you get a test question asking you when you plan to give the next dose of insulin, what they're really asking you is the duration of the insulin. Why? Because at the end of that duration, that's when you'd expect to give another dose. All right? Make sure you guys know the difference. What insulin type has no peak and lasts in the bloodstream for about 20 to 24 hours? Rapid, short, intermediate, or long? I forgot this was a question. I wouldn't have given you guys an answer. Well, everyone should get this right. All right, very good. Long acting, no peak. It lasts for about the whole day. And the patient's getting steady amounts of that insulin throughout the day. All right, the nurse must administer close assessment of the patient according to blank of the insulin action. So when is the time you're going to monitor the patient the closest? When are you going to be most concerned? Onset, peak, duration, or dosage of the insulin? I blame myself. I get ahead of myself and I start teaching and I forget that I have other slides. Very good. Peak time. How did three of you guys still choose the wrong answer after my whole spiel? Peak time. The peak time of the insulin is when you're going to be most concerned. You're going to assess your patient the closest because the peak time of insulin is when that patient's blood sugar can be the lowest. We're going to be concerned about a hypoglycemic reaction. You guys are killing me. All right, immediately following a cardiac cath, you assess your patient and you note the dressing is saturated. What are you going to do next? Are you going to call the healthcare provider? Are you going to reinforce the dressing? Are you going to apply pressure above the insertion site? Are you going to assess the patient? What are you going to do? Immediately following a cardiac cath, you assess your patient. You note that the dressing is saturated. What's your next action? All right, let's talk about it. Apply pressure above the insertion site. Guys, let's go back because you guys are killing me on this live. You guys are really killing me this morning. I know it's early, but I want you guys to think about this. Patient just had an invasive procedure. We know after an invasive procedure, we're going to be concerned about three things. Always. These three things are always going to be our priority after an invasive procedure: infection, DVT or pulmonary embolism, and hemorrhage. So whenever you see a patient had an invasive procedure, before you even finish the question, in the back of your mind, you already need to be thinking about those three priorities, okay? With that being said, it says that you've assessed your patient. It's right there in the question. It says you've assessed your patient because that's how you know the dressing is saturated. So what's happening here? We see that this patient's hemorrhaging. That dressing being saturated, full of blood, they're bleeding out. What's the next thing to do? So for everybody on this live that chose assess, you mean to tell me that you assessed your patient, you saw that your patient was bleeding out, and your brain told you to continue looking at that patient? Your brain told you to do what? Take the blood pressure? What's the blood pressure going to tell you that you don't already see? That your patient's bleeding out. What's the SaO2 going to tell you that you don't already see? Patient bleeding out. What is the temperature going to tell you that you don't already see? Your patient's bleeding out. Let's be for real right now. Okay. It says you assessed your patient. So you see your patient's bleeding out. What is your priority? To stop the bleeding. You're going to apply pressure. And look what it says. Not only does it say apply pressure, does it say at the insertion site? No, above the insertion site. Why? We want to stop that hemorrhage. And my goodness, for those who chose reinforced dressing, so let me get this right. You walk into your patient's room, you assess your patient, you see that they're bleeding out, and your brain tells you to go ahead and get another 2x2 or 4x4 and go ahead and slap it on top of the saturated dressing? How, Sway? How does that make any sense? Absolutely not. Your patient's bleeding out. Your priority is going to be to save their life. To stop the bleeding, you're going to apply pressure to the site. Any questions? I'm sorry, I was yelling. I'm so sorry. I'm sorry, guys. All right. That was our last question. I promise I'm never doing a Kahoot this early in the morning. All right, guys. So that was the end of this Kahoot. This was only 12 questions. Let me know if you guys want more on this subject. And I'll definitely make more because you guys didn't do well at all. I think I need maybe part 2, part 3 on the subject. So go ahead, let me know in the live what you guys think. Those who are going to be watching on YouTube, thank you so much for watching. Let's see how you guys did.